Welcome to PHC's NEPO Special Topics webinar on building meaningful allyship with LGBTQ plus populations in a healthcare setting. My name is Sumedha Gulati, and I am a Director of Strategic Initiatives here at PHC. Next slide. Just a few quick housekeeping reminders here. We definitely want to make this a very interactive learning session. Next slide. So PHC, Physicians for a Healthy California, is a nonprofit dedicated to improving community health, growing a diverse physician workforce, and promoting health equity. Through the Network of Ethnic Physicians, or NEPO as we fondly like to call it, we are bringing together ethnic physician organizations from across California to advocate on behalf of their patients and communities. NEPO's goals are to improve access to care, end health disparities, support practice improvement, and create a more diverse physician workforce. In support of these goals, NEPO has committed to presenting topical information on issues concerning health equity, diversity, and inclusion. Next slide. We would also very much like to thank Physicians for Healthy California and NEPO would like to thank Union Bank for their generous sponsorship support for this event. Next slide. So here's our agenda for the session. As our speakers present, we encourage you to share your name, preferred pronouns, and your answer to the icebreaker question that's been posted in the chat, which is, when did you first realize your gender? Next slide. We are pleased to welcome Wendy Anguiano and Celia Sandhya Daniels to this panel discussion of the unique experiences of LGBTQ plus individuals, and to provide practical, actionable suggestions for how to improve communication with this population in a healthcare setting. Wendy Anguiano is a program manager at Equality California, primarily responsible for overseeing LGBTQ plus diversity, equity, and inclusion training. She trains healthcare and homeless service organizations across California. And Celia is an Asian Indian non-op trans woman of color who is an entrepreneur, musician, photographer, storyteller, activist, and a blogger. Born in a conservative family in southern India, she writes and speaks passionately about her struggles and challenges she faced in her family, work, and community, both in the US and India. She is a management consultant with 20 plus years of demonstrated success in providing strategic consultation and spearheading various global engagements in healthcare and life sciences for the Fortune 100 companies. Celia brings an amazing intersectional blend of ethnicity, culture, faith, and corporate experience to educate, empower, and advocate for transgender, gender variant, and intersex rights in her activism. She is currently the founder and CEO of Rebecon Consulting. She is also in the executive board at Trans Can Work, Inc., and the VP of Stonewall Democrats of Ventura County, California. With that, I wanted to hand over the podium to Celia.
Thank you so much, Sumedha. Appreciate the invite to come and speak to this wonderful group here. I hope you're all having a great morning. For those of you from US, I want to especially thank you for being a part of this amazing session. I live in Southern California right now. The weather is amazing. And for those who are living in colder parts, I'm so sorry about how the weather is today. But most importantly, as the introduction came in, I was just looking at my life and the way as to why this is such an important mission for us to be speaking up in terms of what's happening within the healthcare industry. So if you want to go to the next slide, May, that'll be great. I will be speaking about the four pillars of healthcare. When you look at the healthcare industry today, the provider, pharmaceuticals, payer, and also the policymakers, they are the powerhouse of making decisions in terms of healthcare today. But unfortunately, they have a very binary mindset when it comes to the transgender variant and intersex community. I will be using the terminology TGI in order for me to refer to this conversation today, and also talking about some of the discrimination that we have faced over the years when it came right from the time from HIV to even COVID and surgery that's been happening. There's a lot of misconceptions. There's a lot of ideologies that has been built around the binaries, which the trans community is now trying to change from a binary mindset to a spectrum mindset. Gender identity and sexual orientation as a spectrum. So there are a lot of discrimination that happens even today. Also with the trans veterans, close to 163,000 trans folks who are veterans today. Can you move to the next slide? I've always heard this from organizations, hospitals, and also from different insurance companies. The CEOs and the C-level folks always want to make a change that they say that we want to hire diverse staff working for a diverse population. The way in which they have this mindset is, we want to make these changes and it has to be quick. It's very reactive, not proactive. And when they hire folks or when the patients are diverse, they need to also start training their hospitals or organizations, making sure they have the right policies in place. There's good amount of training and education within the provider industry, and then providing a patient care so that you will have a wholesome experience when the patients, transgender patients, when we walk into the hospital or walk into a place of provider care, the first thing that hits me is, I always keep cringing when my name is being called as Daniel instead of Celia, because that's my legal name. So there are a lot of misconceptions, a lot of areas in which sometimes the patient's first experience in a provider space seems to be very discriminating. And sometimes it can be traumatic and nerve-wracking too. And that's what we're going to change. We want to have these dialogues. We want to make sure that this is a safe space for all of us to talk about what are the issues we are facing and how we can change it. You want to move to the next slide? The probably in the you would have heard a lot of discussions around bathrooms and the issues that's around the anti-transgender bills. There is close to 280 anti-transgender bills in 2022 alone. A lot of them are relating to healthcare, a lot of them are relating to bathrooms, sports, athletics, and also when it comes to the pronouns and accepting a person in a workplace and a work setting. We only see the surface of, oh, why are these trans folks always coming up with these terminologies about pronouns? And it's difficult for us to learn some of these. And why do we need to do it? It's not just about bathrooms. It's not just about pronouns. It's not just about a discrimination, but the whole systemic root cause of what is happening under the surface. What is really instigating these kind of conversations, and how do we change these conversations, and how do we make ourselves aware of it? When I came out to my doctor, I told my doctor about gender dysphoria, and he asked me, what is gender dysphoria and how can I help you? He was willing to help, but unfortunately, there was not much of education around that space. But he didn't know how to help me. He said, is it depression? Are you going through anxiety? How can I help you? Do you have suicidal ideation? I did educate him. And a lot of trans folks today have to educate your doctors. 1 out of 5 of them have to educate the doctors and the nurses and the staff to make sure that they have a best understanding in terms of why they are there and what they're doing. So if you see all the systemic issues that are there, the stigma, the homelessness, rejection, bullying, violence, incarceration, there's so much of issues that trans people go through today. And even the LGBTQ community, when they wanted to give blood during COVID time, there was a lot of bias against the gay community because they said, you might probably have the HIV virus in you. It's just repeating itself. We have never learned from history. We just need to learn to provide better care for our community. Moving to the next slide. These are some of the health challenges that we'll be talking about today. We'll be discussing about why it's so important for the provider community to provide that kind of an environment where you learn and also understand that even coming out and saying that I'm gay or I'm trans, it takes so much of guts, it takes so much of energy, and it's sometimes draining. And that's what we want to talk about. We want to have these conversations where we look up to a community where you are our allies. And that's the most important reason why we want to have these conversations, so we can avoid some of the health challenges that the LGBTQ community is going through today. Moving to the next slide, I will also be talking about some of the areas where we can help you provide ideas where the provider community can provide more, be more engaged in terms of being a volunteer, in terms of understanding education, training. Wendy will be talking about the training and education because it's so important to understand why we use these pronouns and the importance of how we can take this to the next level and how it really reduces. Hiring diverse talent is one part of it, but also understanding the intersectionalities. For instance, I don't want to be known as trans. Celia is not just, my gender is not just being trans. I'm a parent. I have a 22-year-old daughter. I'm married to a cisgender woman. I'm an entrepreneur. I'm a musician. I'm a blogger. Gave that introduction because every time I walk into a space, it's always Celia's, and people, I walk to a grocery store, they look at me, they read me, and they say, "You're a trans person." They take away all the other intersectionalities that you really have. Asian, I'm an immigrant. I have issues that all of us are going through as human beings. Sometimes that's not even looked at. Even if I walk to the hospital for a common cold, I have to go through the whole spectrum of advising the doctors or telling about who I am. And it can sometimes be really nerve-wracking. The next slide, please. The important thing to know, and we will be also talking about it, is, how can you or we all be better allies to each other? The one important thing for folks like yourself in the call is to understand that you acknowledge your privilege. It's an easy way to learn about being an ally to the transgender community, transgender and the LGBTQ community. We talk about listen to the community, learn to unlearn, instigate tough conversations and tough decisions in your workspace, and also educate those around you, support by being involved. And these are the things we'll be talking about today in our conversation, when Wendy will be talking a little bit about some of the education aspects as to how you can educate yourself and also educate others when such conversations come in a toxic environment, suppose you, where you can be an ally to our community. Moving to the next slide. I think it's important for us to understand, and I'm so glad that my friend Wendy is in the call, where we'll be talking a little bit about some of the issues, and we will go through that in our panel discussion. Over to Wendy.
Thank you. Yes. Okay. So hello, my name is Wendy, pronoun she, her, hers, and I'm here as a program manager for Equality California. Okay, next slide. Okay, can you click next so we can see the text, sorry. So I want to tell you a little bit about the organization that I work for, just if you're not familiar. Equality California brings the voices of LGBTQ people and allies to institutions of power in California and across the United States, striving to create a world that is healthy, just, and fully equal for all LGBTQ people. And we advance civil rights and social justice by inspiring, advocating, and mobilizing an inclusive movement that works tirelessly on behalf of those that we serve. So we do these DEI trainings for healthcare and homeless service providers at the moment. Okay, next slide. So this is just like Celia was talking about. We're going to talk a little bit about the educational factor. And so just very briefly, just so we're all on the same page, I kind of wanted to go through a little bit of these terms. And this, of course, should be covered more in depth. We will talk about how to do that after, but this is just brief so we're all on the same page. So sex assigned at birth is a medical classification of female, male, intersex, often classified by anatomical, chromosomal, and hormonal characteristics, including secondary sex characteristics. Gender identity here refers to the subjective experience of one's own gender. This could be that you are cisgender, so you are a person who has a gender identity that is the same as the sex that was assigned to you at birth. So I am a cis woman. because I identify as a woman and I was assigned female at birth. And then there's also transgender, people who have a gender identity that is not the same as the sex they were assigned to at birth. Which is different than sexual orientation, how a person experiences physical, romantic, or emotional attraction to others. And gender expression refers to the communication of gender through behavior, clothing, hairstyles, voice, and body characteristics. I'd like to differentiate because when we use these terms later on during the panel discussion, Q&A, or in the breakout sessions, we all want to be on the same page. Okay, next slide. Okay, so going again, touching back on what Celia was mentioning before with talking about pronouns, transgender and gender nonconforming people often change their name to affirm their gender identity. So this can be different than what's on their insurance or identity documents, oftentimes referred to as dead name, but not always. Just legal name is another term for it. It's important to use the names and pronouns that affirm a transgender or gender nonconforming person's current gender identity, regardless of documentation. If they tell you that that's their pronouns, those are their pronouns, and it's what you should use and practice using. So these are just some examples. There's plenty of pronouns, especially in different languages. But this is just a little chart just to get you familiar, kind of going with Celia's very important information that, if this is something that if you're in that 48% who's uncomfortable with this, this is the time, to get comfortable. You never know who you're going to be treating and helping. So it's important to be comfortable with these terms and different pronouns, just because you want to be providing inclusive care to all your patients. So there you go at the bottom there, if you don't know someone's pronouns because you haven't gotten to ask them yet, it's best to use gender neutral pronouns like they, them, or refer to them by their name until you're able to ask them. Okay, next slide. So just briefly, we're going to touch a little bit here on intersectionality. So intersectionality is the study of the interactions of multiple systems of oppression or discrimination. So being LGBTQ and undocumented, a person of color, low income, or a veteran. Here's plenty more examples, right? Everyone has an intersectional identity. You're not just one. You're not just a man or a woman or a non-binary. You have all these other things that make you you, and those may come up when you're talking to a patient, right, about their care. Some may not be as relevant, but still, it's important to understand the multifacetedness of every person who may come into your clinic or organization, so you can provide them better care. Next slide, please. So here briefly, we want to touch on the perceive and feel framework. This link to this framework will be provided at the end along with other resources, just so you know. But this comes from the 519 Space for Change. They use this framework to help providers understand how to create a welcoming and inclusive space from before anyone even walks into your clinic. So that's with inclusive posters and flyers, having pamphlets that reflect the community, whether that's different kinds of families, chosen families, or LGBTQ icons and activists on like pamphlets, things like that. So that's just some examples. There is more examples, but we'll share that resource afterwards. Okay, next slide. And I want to talk a little bit about access to care. So more than half LGBTQ respondents to a certain report reported at least one of the following: being refused needed care, healthcare professionals refusing to touch them or using excessive precautions, using harsh or abusive language, or being blamed for their health status because of being LGBTQ. They're being blamed for that status, or healthcare professionals being physically rough or abusive in maybe a way that they shouldn't be, like it's not called for, like they weren't being, people weren't like attacking anyone, and they're just being treated that way for no reason. So here's just a little chart, right, differentiating different communities. So this is just one of many studies. We will share the link to this at the end, resource at the end. It's important to keep in mind that there could be biases that you're not aware are coming out, and this does impact people's access to care and may make it so that they don't want to try to access care even when they do need care in the future. Okay, next slide. We briefly also want to touch on COVID. There's lots of things to mention about COVID. One thing that I will highlight just here is about the consequences of physical distancing for LGBTQ youth, is that decrease in positive social interactions they may have from clubs and community, that they now more isolated at home, and also an increase in negative social interactions because they may be, having to be at home and they may not have access to these communities. This may be something that affects your clients or patients. So we just wanted to highlight that there's lots of things to talk about with COVID, but this is just one that we wanted to highlight today. Next slide, please. Okay, and so just to cap this all off, just letting people know, what I went over is just a brief, very quick, high-level view of this kind of information for providers. But Quality California Institute, part of the Quality California, we have this online training for free for healthcare providers. We're currently adding more courses this week, but we go more into depth on these: LGBTQ 101, intersectionality, health disparities, creating a welcoming environment. And we are also expanding our HRB course this year and hoping to expand that for healthcare providers. We will provide the link at the end. Also, I will provide my email in case you don't have that link or want to ask questions, or you want us to provide training for your healthcare office or agency. But this, kind of, even if you don't come to Quality California, you talk to other organizations, just know that receiving this education and going through trainings is just one step to providing that inclusive patient-centered care. Okay. Next slide, again.
Thank you so much, Celia and Wendy, for your eye-opening presentations and introducing us to the complexities of LGBTQ experience in healthcare settings. We now would like to move into our 10 to 15-minute panel discussion for our panelists. So, either you or Celia, you or Wendy could start, and audience, if you want to, you want to add on to that, please do put it in the chat. For both of you, LGBTQ plus individuals face additional barriers to healthcare, including low rates of health insurance coverage, fear of discrimination, and negative past experiences, all of which may contribute to patient reticence. What are some suggested strategies for how physicians can create a welcoming healthcare environment and improve their communication with LGBTQ populations?
I can start. It's a great question, and we've been talking about this in various settings where it's important. The education is the important thing, as Wendy was talking about. There are so many ways in which we can educate ourselves. And when you support the community, it needs to be two ways also: educating yourself and also educating others. So educating yourself is to make sure that you're knowledgeable on what issues trans folks are going through, like simple terminologies like gender dysphoria, in the DSM manual, it's in your DSM-5. Understanding what type of ICD codes they are related to so that we can give the right kind of treatment for this person. And when the trans folks walk into giving them, I would say, the patient experience, that's the most important thing in a world where it's all digitized, and looking at the way in which we are transforming healthcare. We need to be at a point where we can also educate some of the companies that we're working with, like your GE products, EMR products that you have. When you are entering just male and female into those, you can also think about and tell them that I only have male and female here, but I have a trans patient and she wants to be, he or she or they want to be known as a gender non-binary, and there is no option for them. And you can ask them to go and change it. And I have done that for companies, and they have changed, and it's possible. And a lot of products are being very inclusive in terms of adding more data. So the more and more you add information and the demographics and information about your patients, the better you will understand about the stigma. For instance, Apple had created a small emoji for a pregnant man. So basically they were saying that there are trans men who are pregnant too, and they need to be treated like the cisgender women who are having the medical leave, and especially during pregnant time. But sometimes they don't look at osteoporosis as something that men can have, trans men can have, and gender non-binary population can have. So the stigma has to be taken out. So there's a lot of stigma around it. It's so important to educate yourself more and more. Open your mind from the binary mindset to a spectrum mindset. That's the most important thing too.
Yeah, just to add to that as well, I do think it's important to step back and make sure you're educating yourself, and you're working that your agency and whoever is working with you, doctors, nurses, everyone involved, front desk staff, everyone is getting that education before you have trans patients, for example, coming in, because you want to make sure that you show them that you're knowledgeable and you took that extra step to learn, and making sure that you're providing that information to your trans patients, right? Oh, I heard something. Oh, sorry. But yes, because if you you don't want to wait until you have a patient who maybe they're younger and don't have all the answers, right? They just understand like, oh, I want to change this, but I'm not sure how, or those kinds of things. So you want to be proactive, making sure, education is just the first step, making sure that, you're maybe keeping up with medical journals and different things about gender and sexuality, because this does impact your patients. That's a huge part of their patient experience. And if you're providing this inclusive patient-centered care, you want to make sure that you want to be prepared, right? And so preparation is key, making sure that your organization is also prepared. So if you're seeing gaps, like, our intake forms, they're missing maybe a non-binary gender marker, as Celia was mentioning, right? Like, or something like that, that we're proactive, like, let's talk to consultants, let's talk to who we need to talk to make sure that we make these changes for current and future patients. That's another way of showing that you have an inclusive and welcoming environment in your clinic. So I think that's definitely another part of it.
Thank you. Thank you, Celia. So essentially just the knowing your population with the data gathering, as Celia mentioned, and then that education component is what stood out to me amongst your other all your comments. What about so what you also mentioned the concept of intersectionality. What can physicians do to demonstrate mindfulness of the intersectional identities of their patients?
Wendy, do you want to take? I know you just spoke about intersectionality.
Yeah, sure. I would say that being cognizant of things that may impact your patients that would be due to intersectional identities. For example, maybe you do have already an inclusive and welcoming space when it comes to LGBTQ identities, right? Like, let's say that you have all those certain things in place, but then you do have certain questions you're asking in the intake that maybe someone who's undocumented may fear, oh, maybe I can't get care here, right? Like, maybe you do have things in place to help undocumented patients to access care, affordable care, right? But if you have certain questions about citizenship or nationality that don't need to be in the intake and are there, that may be a barrier, for example. So if you're not cognizant of like, oh, maybe I'm like, for example, in Southern California, we do have a huge undocumented population. So that is something to be cognizant of, how, oh, we may be preparing for one thing, but we're not necessarily cognizant of other things, like LGBTQ undocumented folks are having a lot of trouble because the reason that they've come here to try to seek a different kind of life is because maybe there's like transphobic policies where they're coming from, right? That's just an example that may affect an LGBTQ undocumented person, that if you're not cognizant of that, it may affect how you communicate. That also comes to language, right? Maybe they are comfortable speaking English, but if they aren't, do you have translators? Do you have someone there, interpreter, someone who can help? So that's something also to be cognizant of. For someone's intersectional identities, it's just about knowing who are the patients that you're serving, asking and finding out who are the people who are around in the community, and making sure that you have different ways of getting those needs met. So that would be something to that I think that agencies can be cognizant of for providing inclusive care in an intersectional way.
Yeah, that's a great point, Fendi. And also it's important to understand the traumas that LGBTQ community goes through. There are close to 41% of them who have attempted suicide within the LGBTQ community. The numbers are even high for the trans community. When we understand the challenges they're going through, if you look at the ecosystem around a trans or an LGBTQ patient, they go through a lot, as I showed that picture about what they are going through systemically. So when you give them the right kind of care, when they are welcome, when they feel that they are safe, the patients feel vulnerable in that kind of a environment. And especially when they're trans, they're even more double vulnerable, or multiplied into 10 times. They feel so vulnerable. And so it's important for education to there has to be a lot more emphasis on education, and also provide more of these trainings. And I understand there was a recent research done for the nursing community in San Francisco. They found that there were only, at the time when they did the research, they found only 2 hours of education for the LGBTQ awareness. And it was just like a topic they had to brush through it. They need to understand pronouns at a very high level. And when I was speaking at the Seattle School of Nursing, they were all talking about, hey, we don't know much about it. We have to learn from social media or learn on our own. And that kind of an education can be given by the doctors community. You can have forums, panel discussions, where you talk about how can we open up not just trans, but Black trans community, not just brown people, but also immigrants who are brown. That's the way in which you want to have these conversations. So yeah.
Thank you, Wendy and Celia. We actually also have a question in the chat from the audience. Max asks, how do you operationalize care intake for patients who are experiencing gender dysphoria? Is there a checklist used or being developed? Is there something like the ACEs assessment being developed?
Yeah, it's a great question. And I have been going through this myself because when I came out, I didn't understand why, plain facts, right? I was thinking about why is a man wanting to be a woman? And that's how I took my case study. And I said, I'm attracted to women. I'm born as a man, but why am I wanting to be a woman? I couldn't answer that question for years and years. I started studying a lot of articles, and I looked at John Hopkins research and Stanford and Harvard Medical School. I started reading all these articles from different sources, even from Europe. What I found was the word gender dysphoria kept on coming to me. The reason why you are different is because you have gender dysphoria, and that dysphoria can cause you to act differently. So bottom line, there are certain ways in which you can diagnose dysphoria, and that's why it's important to go and talk to a psychiatrist and tell them that you are trans and you don't identify as a cisgender person. Now, when that is the first question that they ask, do you identify as in the gender you're born? And then there are lots of ways in which they can do it. I can also post here. I will be posting in the chat that there's WPATH as one organization where they have done a lot of research. USPATH, WPATH, they do a lot of research in terms of gender dysphoria and also break it down into various medical components and the way in which you can cure gender dysphoria, or I would say address gender dysphoria. I have gender dysphoria today. It was probably at a very high magnitude, but once I found an acceptance in my own community, in my own house, it got better. So my wife took 17 years to accept me. My daughter took 25 minutes to accept me because she's 22 and my wife is 51. I gave away her her age, but that's the way it is. When the more we educate ourselves, it takes the better we are in treating others. So my doctor now understands that if I am having a heart trauma, he says, it could be stress induced. Now he understands gender dysphoria. So there is a way in which we educate, but also the medical community can read about them through the American psychiatric journals. And also there are some articles like in WPATH and USPATH, where you can learn a lot more about gender dysphoria and also how you can assess that it's there.
I guess just a quick note to add, speaking of other medical journals, there was something I thought I'd have to look it up to make sure to have an accurate source, but I have seen that some people for intake talk about body parts and different organs that people may have, for example, rather than generalize what someone has, kind of like a inventory of sorts, right? That may be a way to mitigate if someone has gender dysphoria when being asked about specific things or procedures, right? That may be assumed to be female or male. So that's something else to keep in mind, right? That there is already processes in place for different ways to ask questions. If you already have someone who has come to you and says, oh, I have gender dysphoria, they don't like when you ask me certain kinds of questions or things like that, or assume certain things about their gender, things like that. So, but I'll have to look it up just real quick to make sure to share that. But just to add on a little bit to what Celia was talking about, that yeah, that's very important. And people in journals are already talking about these things, but unfortunately, it's kind of slow to trickle down.
Thank you, Celia and Wendy. One of the things that stands out from our discussion is that it's very much systems thinking that we need to apply with the knowledge that you've shared with us, the concepts and the knowledge that we shared with us. It sounds like we have to really apply like the systems thinking at so for example, Wendy said at the intake point of intake, what can we do to improve our data gathering? What can we do downstream as well to in our communications with the patient? So very much as healthcare is very much a systems focus on how to improve care for LGBTQ populations. And next, I have a question that's actually going to lead into that's also going to help with the breakout sessions that we have. What do you, how can physicians encourage colleagues and organizational leaders to join them in allyship?
I had mentioned about being an ally, acknowledge your privilege, learn to unlearn, listen to the community, instigate tough conversations, and also be supportive. Now, I just want to move to that supportive part, is where a person like me, when I walk into a restaurant in Texas, the restaurant owner can look at me and say, I cannot serve you because my religion tells me that you are trans and I cannot serve you. When I walk into a hospital because I have a broken limb or I'm feeling sick and I want to, get a quick medicine or a diagnosis, the hospital, the nurse or the hospital themselves can say that you're not allowed here. Now, to me, that's appalling because I don't have to explain to them as to why I am different and why I need care. Now, that is the most difficult situation where a lot of LGBTQ folks are in today, where we have to explain about, and you have close to 280 anti-trans bills that are there today. Now, how can you be supportive is when you have these conversations with people who are your friends in a community, you can bring up the fact that trans people are struggling today. I cannot use a men's bathroom. It's not right for me to do it. And if a state law is being written that way, saying that we don't understand what you're going through, but this is not right, we have to explain through science as to why it's important for people to go through these issues, why children come out at an early age. I came out to my mom when I was 4 years old. It's when the children come out and tell their parents that you're different, the parents need to listen. They need to understand, or else I lived in a situation where I couldn't come out in India. It was hard for me to come out. And those are the conversations the medical community needs to have. So when they take the children to the doctor and say, the doctor, my child is talking about that they don't belong in the gender, what do we do? Now the doctors are educated enough to tell the parents that this could be gender dysphoria and let's run a few tests. Let's just go through, let's identify where the problem is. Your child is a normal child. Child is not abnormal. Those kind of, I would say, affirming conversations, affirming care is what people are looking for. And so it's when you have these discussions in your breakout, think about the human side of it. And that's what I always tell is humanize the LGBTQ issues. Don't politicize it. Do not put a religion around it. This is basic human care. When a person is on the road, I want to just go and help the person, not that the person doesn't belong to this community or whether this person has a gender issue. And I don't think anyone in this call believes that. We are in this profession because we want to care for people. And that's where I want to also iterate that, educate not just yourself, but be our allies, hold our hands when we enter the hospital. That's the kind of allyship that really makes a change in this world.
Yeah, just like to add on to that. I do think that, of course, education is key, having that. And I do think that helps change minds, change hearts, right? But that's a very long approach, unfortunately. But I do think it's incredibly important, right? It's part of the work that I do. I also think that people can use their power as allies to form committees, use the latest science, right? Because science would back you up on this, right? And unfortunately, that is something that people may hear if they're not listening to that storytelling aspect. They may hear that science and data would back you up to say why these are important things to include or change to make this an inclusive place and organization as a whole. I also think that you need to find new ways to push inclusive policies, maybe unconventional. For example, if you want there to be more gender neutral bathrooms and you have someone who's saying maybe one particular person in your organization that's kind of being stubborn about it, you can pose it another way. Like, how does this benefit people who want to have more accessible bathrooms with railings and things like that? But how does this benefit single dads who maybe they also need baby changing stations? And so those are traditionally only found in women's bathrooms. If you have more gender neutral bathrooms, you're giving that access to more communities, right? Everyone benefits from this inclusivity. So you can find different kinds of approaches to still provide that inclusive care, because you realize lots of communities benefit from this, right? And maybe they'll try to say, due to maybe some bias that they have, they might say no for this reason. But if you provide these other reasons, it's like, how can they say no? So I also think that that's important to being allies.
The one tip that I can give you before you go into the breakout is you can walk up to a trans person and say that, hi, my name is Kristen, and I go by she and they pronouns. How about you? And that's the way you introduce the person. And even just by their appearance, do not judge the person by their appearance, because they may look different, but they don't want to be identifying the gender that they're born. So you always want to introduce yourself and then let them open up. And when you put your pronouns, saying that even in your name tag, when I walked into UCLA, I was having my colonoscopy, and I found this person had this pride badge. The nurse had a pride badge, and it could just brighten my eyes. I was able to talk to her in length, and we kind of connected well. She was an ally. She was not in the part of the community. Those are little things that you can do to brighten a person's experience, a patient experience. Introduce yourself, and then those kind of pronouns are one way to open up these conversations.
Okay, well, welcome back, everyone. If some of you would like to share your conversations and what's stood out to you in your conversations, we'd love to hear.
I think in my group, Dasha and Nathaniel were bringing up some great points. Dasha, do you want to talk about it?
Sure. Thank you, Celia. So basically, the point that I brought up is just adding on to what Celia was saying about the different intersectionalities of identity is to really taking those time to have the conversations to really get to know all the different intersectionalities that are identified with that individual, and that's going to help us see all the different similarities that we have in shared interests, and just really help us get an appreciation for the person as a whole. And I think Nathaniel, did you want to share as well?
Sure. So one of the major things that I liked about what Celia said is just the simple fact that, and I said this as well, people need to get back to the point of accepting people. People are different. People have different color hair. People have different color skin. People have different things that they believe in, that they do on a daily basis. And I think it's important to realize that fact, especially moving forward, that everybody is a person. Everybody is a human, and everyone should be treated equally. It's not hard to be nice to someone. It's not, and there are 1,000 things that you can talk to someone about. 1,000 things. I found out Celia loves music. She loves being a parent. She's going, you know, there's so many different things, so many things to talk about. And I believe that that has been lost. The whole point of the communication between people. And I think that if, you know, that's addressed and communication is, you know, worked on and pushed forward, I don't think that I believe in time that, you know, it'll resolve itself.
Thanks, Nathaniel and Dasha. Sorry, Celia, go ahead.
No, I was just thanking them for.
Oh. Well, I can speak to, well, Cynthia and Ronnie, would you like to, they also made some really interesting points in their discussion.
Sure. Yeah, one way for folks to be an ally is to encourage, so find a way, whether you're working for an organization, you're a medical provider, but to integrate folks from the community within your day-to-day basis. So whether you're serving on committees, making sure that there's representation that wise, also allowing folks from the community to actually drive conversations. So as we're doing research, a lot of the time, sometimes folks outside of the community will speak on the behalf of folks in the community. So to eliminate that, just to allow opportunities. So a metaphor would be having a seat at the table. So not only having a seat at the table, but setting the table. So creating an environment that allows folks from the community to actually feel safe and to come down and to be able to collaborate and have impactful roles within decision-making processes that affect them as a community. So allowing that metaphoric seat at the table, but also setting it as an organization to make sure that what's being discussed, policies, practices, and all of that are reflective to support members of the community as well.
Hi, I'm Cynthia. My thoughts were more on the personal growth front in terms of understanding and personal education. And I find that like following Instagram accounts that, you know, promote understanding, tolerance, understanding of culture, especially with humor, has been really helpful for me in terms of like feeling connected with other people that I might see as other.
Thank you, Celia and Ronnie. Would love to, we have about 2 minutes. We'd love to have some other folks share as well in the audience.
I can share. Hello, hi, my name is Max. I go by the pronouns he, him, his. And I think in terms of our discussion with Jessica and Lupe, I always think about like operationalization. I think I always want to see how we can, you know, kind of move these abstract ideas into concrete, actionable, you know, steps into the healthcare system. And I think one of the things that I did learn was that we all kind of play a small part within the system. Like I'm part of a loan repayment program, and we recently introduced a question regarding addressing patients on the LGBTQIA spectrum. And that's just one small component, but I think with Lupe and Jessica, they were thinking about other components as well. So how do we not only like after they finish their education, how do we integrate it as a part of their you know, their residency or as a part of their medical training as well? Because it's, I can understand from a physician or dentist perspective where they're kind of, they've never encountered this, this type of identity before because they weren't introduced, you know, during medical school or dental school, and kind of having that integration systemic wide so that there's familiarity. And then there's also like, there's also a there's also something built in place for them. And so it doesn't come as a surprise when they do see a patient experiencing gender dysphoria.
Thank you, Max. So with that, we have about 2 minutes left. Wanted to open it up to any audience audience questions. And Celia and Wendy, if you have any closing comments, we'd love to hear.
Yeah, absolutely. Sorry, I was just looking for my mic.
No, no.
mic, yeah. The most important thing I would love to just keep in mind is to, for us to keep in mind is to humanize these issues that we see in the media. Media industry can sometimes be too overwhelming about certain issues. And when you see those issues, always think about the human behind those issues, not just the issue alone. So that is a real important thing, which I would talk about and I would focus on, always think about as Wendy and Celia, when we were in this meeting, one thing that we had left with you is, when you remember about us, always we want you to think as we are human beings and all of us are in this together. So the world is changing. 27% of the youth in California alone identifies gender non-binary. 60% of our workforce in 2025 are going to be millennials and Gen Zs. So world is changing, people are changing, and there's a lot of inclusivity around what's going on today. But there are some pockets where we need to educate. So if you feel that your system, your hospital, like someone was talking about, speak up. They brought up this thing as speak up. It's so important to speak up and say, hey, I think we shouldn't do this. Like Nathaniel was telling in our meeting that, speak up when you see something around you. Someone is joking about a trans person, speak up. Someone is passing a very derogatory comment about this person, speak up and say, I don't think you should say that, So remember this is the axiom that I use always. You can always educate a person who's ignorant, but you can never educate a person who's arrogant. So we never want to be in that position where if someone makes a mistake and they're willing to change, it's okay. If you use the wrong pronouns, it's okay. Just say, I'm sorry and move on and try to learn. Don't dwell upon it and don't think that, why should I use they pronouns for you? And that's the arrogance that never helps in any human race. So I just wanted to, leave it at that.
Yes, 100% agree. It's about education and being open-minded and, understanding that we have to be that gentle learning, right? Because at the end of the day, we're trying to change hearts, change minds, and, be more inclusive. So 100% agree. Thank you, everyone, for joining us.
Thank you. Thank you so much, Celia and Wendy. This was really great. And I think definitely the message I got, being humble and continuing to learn. So this has been very educational for us and the audience. So I wanted to thank both of you, thank the audience, and also thank our sponsor, Union Bank, as well. We have, if you have any questions, here you have the NEPO email address. And we will also be sending out the slide sets afterwards, and they'll include the resources that were posted in the chat. Thank you, everyone. Have a good day.